Welcome, my name is Peter Strong. I am a professional online therapist specializing in mindfulness therapy for the treatment of anxiety, for the treatment of depression, and also for helping you overcome post-traumatic stress disorder and help you recover from traumas as well. So PTSD and emotional trauma simply refer to very intense emotional experiences that the brain is not able to process by itself automatically. We need to process it by some form of psychotherapy. Medications have their place for controlling symptoms of PTSD, but medications are not sufficient to treat the underlying psychological process that creates your emotional trauma or associated emotions like guilt or shame or anxiety or depression. So if you're looking for a non-medical approach, if you're looking to treat your PTSD without using medications, then I would advise you to take a look at my website and learn a little more about how mindfulness therapy can help you overcome your PTSD. During online therapy sessions, I will teach you how to work with the traumatic memories through a process called mindfulness-based image reprocessing, and also to work with the associated core emotions such as anxiety, panic attacks, and depression that are associated with the emotional trauma, and that we call mindfulness-based emotion reprocessing. The key to working with trauma is to actually develop a stable and non-reactive relationship with the traumatic memory. That's the first step. We have to reprocess that memory. And we do this by actually meditating on the memory itself and developing more and more consciousness around that memory. The real issue is the fact that we tend to react to the memory unconsciously, and we tend to identify with the memory unconsciously. We become overwhelmed by it, we become controlled by it, we relive that memory essentially. So by meditating on the memory, the traumatic event, you're actually learning to change that conditioned unconscious process to a conscious relationship. And that is critical. Otherwise, we are simply going to relive and re-traumatize ourselves, and that will simply feed the PTSD. So we build a conscious relationship with the emotional trauma. We then begin to explore the imagery of that trauma. So emotional trauma is created by internal psychological imagery. It might be as simple as the memory itself, a memory image with intense details and color and clarity of the image. That is what actually creates the emotional trauma. It becomes very real because of the detail and sharpness of that memory image. So when we begin to explore how the imagery works, we look at its details, we can begin to change that imagery. When you change emotional imagery, you change the emotion. That is a fundamental principle that we utilize during mindfulness therapy. I can't emphasize this enough. One of the key components to recovery from emotional trauma and PTSD is to change that emotional imagery. One very simple technique that many people find surprisingly effective is to actually simply change the size of the imagery that they see, the size of that memory picture that gets triggered in the mind during a flashback. If you take the image and make it 10 times smaller, that will take away a considerable amount of its emotional intensity. Just shrinking the image down will make it considerably less intense. So this is one way that we can reprocess the traumatic imagery. We just make it smaller. We train the mind to make the memory image smaller. And each time we do this, it loses intensity. And when it's sufficiently processed, then the trauma basically is resolved. And we can still remember the event, but not experience the emotional re-traumatizing. So that's one very simple technique, and it's something that you can even try yourself. But I will teach you how to do this in great detail. There are many other ways we can work with this imagery, and I'll explain these to you as we explore how to reprocess your emotional memory. The other part of working with PTSD is working with the associated emotions, the anxiety, the guilt, the depression, whatever it might be. That emotional content also needs to be reprocessed. And we do that in very much the same way. We first build a conscious relationship with the emotion itself, seeing it as an object in the mind, in a similar way that we would see the memory image as an object in the mind. So that's the first thing, being able to meditate on the emotion without becoming reactive and without identifying with it. The emotion will also have its associated imagery, which may be different than the memory image. It may be more abstract in nature, but all emotions have associated imagery, and the same rules apply. When you change that imagery, you change the emotion. So we work on establishing a non-reactive relationship that doesn't feed the depression or anxiety. And then we look at helping that emotional imagery change. And when it changes sufficiently, then the depression or anxiety goes away. It's basically resolved. So this is a brief overview of how we can apply mindfulness for overcoming PTSD. If you'd like to learn more, do please go to my website and then reach out to me by email if you would like to discuss this further. So this is a non-medical approach. It does not use medications. It basically helps you change the underlying psychological process that causes your PTSD. So I look forward to hearing from you and helping you overcome your PTSD or emotional trauma. Thank you.